Is flu transmission airborne or through contact? Have you ever wondered how the flu spreads from one person to another? Understanding the ways influenza virus transmits can help us protect ourselves and others. The influenza virus primarily spreads through respiratory droplets, but it also uses airborne and contact routes. Each method plays a role, depending on the situation. When someone who is infected coughs, sneezes, or even talks, they releases respiratory droplets that contain the virus. These droplets are relatively large and usually travel short distances, about 1 to 2 meters, before they settle on surfaces or the ground. If someone else is close enough, they can inhale these droplets, or the droplets might land on their mucous membranes, like their nose, mouth, or eyes. This is the main way the flu spreads. Now, let's talk about airborne transmission. This involves smaller particles called aerosols. These tiny particles can stay suspended in the air for longer periods and travel farther than the larger droplets. Airborne transmission is particularly significant in enclosed spaces with poor ventilation, like crowded rooms or healthcare facilities. Studies show that this route can lead to outbreaks, especially when people spend a lot of time indoors without good airflow or masks. Contact transmission is another way the flu can spread. This happens when a person touches surfaces or objects that have the influenza virus on them, known as fomites. After touching these contaminated surfaces, if they touch their face, especially their nose, mouth, or eyes, they can become infected. The virus can survive on surfaces for hours to days, depending on the conditions. While this method is less efficient than respiratory routes, it still contributes to the spread, especially in places like schools or offices where surfaces are frequently touched. The importance of each transmission method can change based on several factors. These include the specific strain of the virus, how immune the population is, environmental conditions, and even human behavior. For instance, during events that lead to increased indoor crowding, the risk of airborne transmission rises. This highlights the need for measures like wearing masks indoors and ensuring good ventilation. To effectively reduce flu transmission, it's essential to address all these pathways. Promoting good respiratory etiquette, using masks in high-risk settings, ensuring proper ventilation, and practicing good hand hygiene are all important strategies. By understanding how the flu spreads, we can take steps to protect ourselves and those around us. Always remember to consult healthcare professionals for personalized advice and guidance on flu prevention.